A very good afternoon to all of you. I am Dr. Asha Dalal, Director of Obstetrics and Gynaecology at the Reliance Foundation Hospital and Research Center. We are celebrating Menstrual Hygiene Day. What is menstruation? You all know that menstruation is the cyclical shedding of the lining of the uterus, which happens regularly in all people, all childbearing age people. Normally, this happens if a pregnancy has not taken place, and the number of days of the cycle vary from 28 to 30. But a cycle of 21 to 35 days is also considered okay. Now, hygiene comes from the Greek word hygies, which means healthy or sound. We need to follow menstrual hygiene. Why? First of all, because we want to keep healthy, we want to prevent irritation, we want to prevent infection, and most of all, most people are worried about odor, a foul odor. So if you want to feel good, it's important to practice some simple tips about menstrual hygiene. Now we come to about menstrual hygiene. The first thing is, during these times or even otherwise, it's always a good idea to wear a cotton underwear. It prevents irritation. During the period, whenever you have a period, if you are using a pad, it's important that the pad is changed every 4 to 5 hourly, or every time you go to the bathroom, you change the pad. Don't wait till the pad is fully soaked to change it. Now, in our country, still a lot of people use cloth. If you are using a cloth, see that the cloth is soft and it has to be washed properly before reuse. Also, don't go on and on and on using the same cloth. See that it is changed at regular intervals. The third thing we are going to talk about is tampons. Now, if you use a tampon, see that you change it. What happens is, sometimes if a tampon is forgotten, this can lead to infection, not only in the vagina and body, in the uterus, but all over the body. This is called the toxic shock syndrome. So you don't want this to happen. Make it a habit of regularly changing tampons. Now the next thing I'm going to talk about is what many people have switched to nowadays, and these are the menstrual cup. These cups come in various sizes, and once you are comfortable using them, they fit the vagina properly. They are environment friendly because you don't need to dispose them off. You can reuse them. They are cheaper because once you buy the cup, it lasts you for quite some time, and there is less chance of your soiling your clothes while you are using a menstrual cup. Now that brings us to a very important point, and that is about the disposal. Please, sanitary towels are not to be thrown into your toilet. Please see that they are disposed of properly. Wrap them in a paper sheet or a paper envelope and throw it where it is supposed to. You don't want some rag picker, some rag picker to soil his hands because your pads are just chucked. They must be disposed of in a healthy, environment-friendly way. The next important thing which you must do is, when you are cleaning, wash from front to the back. If you do it the other way, there is every chance that infection from the rectum or a part of the stool, as they say, can occur in the vagina and up. And also, this is one of the commonest causes of getting urinary infections and repeated urinary infections. So, make sure that when you are cleaning, clean from front to the back. Now, water and soap is good enough. Just soap and water, clean every time you are changing a pad or you are passing urine. Now, you may say everywhere soap is not available. Fine, plain water is good enough. So long as you are cleaning from front to back and keeping the area dry. you don't want to keep that area wet because wetness leads to irritation and infection. So see that you clean every time that you go to pass urine or to change pads. More important than that, pass urine often. If you do not pass urine, what is called stasis happens. That further leads to urinary infection, and this cycle continues. So see that you are drinking water and passing urine. Now drinking water is not only for urine, but it will help in reducing period pain and cramps. So first let's talk about what is a good diet. Water, as I have already told you, drink plenty of water. Then you should eat food, plenty of citrus fruits, foods which are rich in iron because you are losing blood, and calcium. If you have adequate calcium, it helps in reducing the symptoms of PMS. Now, as I was telling you about period pain, many people, they follow these traditional methods of a hot water bottle or warm baths. Yes, it helps. But other natural methods include drinking plenty of water, exercise. That is, a good walk definitely helps. Ultimately, it helps in reducing stress, which is one of the major causes of getting a pain during the period. So besides drinking water, exercising, to reduce stress, you decide what is good for you. You can do yoga, you can do other forms of exercises, you can do meditation. Whatever suits you, that is good enough for you. Meditation is helping a lot of people. Lastly, we come to medication. Of course, there are several medications which are given for you to relieve your period cramps. And don't hesitate in taking them. There is no need to suffer. If one doesn't work, there are several others. Or you need to visit your doctors to look for why you are getting the pain, and if a cause is found, you need the cause to be fixed. Then lastly, be prepared. Most of you are tracking your periods, and even if you are not tracking, most people are aware of when their period is likely to be. So whenever you know you are expecting a period, a few days before that, it does not harm you to keep a sanitary pad in your bag, in your school bag, in your handbag, in your purse, wherever. Today's pads are very small, but it prevents embarrassment, it prevents soiling of clothes, and it keeps you confident. So, as I've told you, that maintaining hygiene during this time, not only menstrual hygiene, personal hygiene also keeps you confident during these days. And it's very, very important that you take these days in your stride and do not let them affect your work or any other activities that you enjoy doing. Thank you.